Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit systems of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm your host, Jenny Sutherland, and with me today are two of my favorite people. I thank you both for being here. You guys are from the Linda Manor Care Campus.
We are, thank you.
Bonnie and Emily, thank you for being here. And I said Care Campus, so Bonnie, can you tell us what a Care Campus is and where it's located?
Sure. So two affiliates of Berkshire Healthcare are both on the campus, Linda Manor Extended Care Facility and Linda Manor Assisted Living Facility. We're located right on Route 9, so it's right below Williamsburg, but right past Look Park and the VA hospital.
So it's part of Northampton area?
We are part of Northampton.
All right. And Linda Manor Extended Care Facility has been there since the 80s, I believe. So
That's
part
right.
of that community. And we want to shoot over to Emily because she's very happy to say that she's from the assisted living. And what do you do there, Emily?
I'm the executive director, and we're very proud to just celebrate our year anniversary.
Very good. And that's so the two together make the Care Campus. So Bonnie, why don't we talk about the services that people can find at the Extended Care Facility?
Sure. So our extended care facility is broken down between short-term rehab, long-term care, and dementia care. So we have 41 beds for short-term rehab. The short-term rehab would be really initiating the transition between the hospital for a hip, knee injury, a short-term goal stay, typically less than 2 weeks.
Okay.
Long-term care is 24-hour care. We have 40 beds designed for long-term care and 40 additional beds for dementia care patients that need a 24-hour care.
Okay, so 3 different areas within the building.
That's right.
Rehab services, available there, and activities, yes?
Absolutely. Activities are involved for both the long-term care and short-term. They're offered across the continuum.
Okay.
Dementia care actually has their own program from 7 in the morning till 7 at night. They have a specialist up there, Sandy, who does our dementia activities.
And actually, I've watched her in action, and she is a very dynamic person, and I'm very happy that she's helping give those residents of yours a better quality of life. You're lucky to have her. And we're going to come back to that part of the extended care facility. We want to go over to Emily because, again, you're itching to talk about the assisted living. Assisted living. First, why don't you say, you're as the assisted living is new to the community, you're also new to the community, because a little bit about both of those.
Yes, so I've been there for about 5 months, and I'm very proud to be a part of this wonderful community. I think they've really done a great job to grow and thrive and helps provide services to the Pioneer Valley. So what assisted living does is it's a great way to help people in their own home-like environment, and it helps people that really might need some more structure and help with day-to-day living.
Sure.
So we can help you with their activities of daily living, certainly to help care for anybody. There's good case management if you have some comorbidities through the nurses, and also we have great transportation and great activities to help people live a nice, thriving, successful life.
That sounds great. And so at the assisted livings, you have different kind of living arrangements. You have studios, which is a room that has a bedroom area and a kitchen space, and then a 1-bedroom, and what does that have?
So the 1-bedroom has the same kitchenette, and it has a separate room to live in, a living room and then a bedroom. And we also have 2 bedrooms, which is really great for couples.
Sure.
That really helps a lot, and we've had a lot of couples come in recently, and they really appreciate being able to have the extra space and still be together.
And I read through the brochures about the place, and it said it was all-inclusive. So what comes with the all-inclusive?
So all-inclusive encompasses of course, your food, all of your medication management, assistance with activities of daily living, transportation, housekeeping, laundry, and we're very unusual. Not a lot of places have all-inclusive assisted living, and what I think is wonderful about that is it allows someone to kind of age in place, so that as who need more help as time goes on or your needs change, we're not going to be nickeling and diming you for all those extra services.
Sure. And I noticed that there was a picture of a pretty slick van bus, and you not only take your folks out shopping, into the movies and entertainment things, but also the doctor's appointments.
Absolutely.
So that must be a pretty nice service to the families and the residents, so they don't have to worry about that.
Yes, especially with the winter coming up.
Sure.
Everyone has been very pleased that we will take you to your appointments. And some folks would like a little extra TLC, so we will send an aide with you or a staff member if that will be helpful.
And so you guys, for the care campus, you kind of are a continuum of care too, because you could start off at the skilled nursing facility and end up maybe choosing to go to assisted living instead of back home in the community with home care, or someone could start off there. So is that how it generally works?
It does. I was just thinking about the segue there for the van, because assisted living will hold an event where, like, leaf peeping, and it's actually just not the assisted living facility, it's the care campus. It's actually offered to go attend that. So we'll have a mix of long-term care residents on there as well as assisted living residents all along for that activity and enjoy that ride to do such things like we just did, the leaf peeping for
which is
this
very
end of the
popular.
year.
I think that's it's
Yeah.
a great
Very
time
popular.
of the year to do
So to touch on the studio, the two-bedroom or the one or the approach for the couple, it's quite often these days we find a wife in the hospital. They're from the assisted living. We take care of her after her fall, short-term rehab, and then she goes again back next door and continues life as normal. So the approach there has been successful with reaching out to really a joint connection for the campus as far as to really provide that continuum of care.
Sure, sure. And I just want to acknowledge, Bonnie, at the extended care facility, you guys have recently won some pretty cool awards, and I want to just shout that out to folks. What have you guys accomplished lately?
Yeah, so the American Healthcare Association compiles this team on their panel of experts that look nationwide for people in long-term care that really excel in providing the basic and most primitive care for long-term. So they looked across the entire nation, and we have just been awarded in 2013 the Gold Quality Award.
So that's the
for
highest you
ACA.
can get.
It's
out
the
of
highest
that,
award that you can.
And you have to win the silver, the bronze, and the silver before you get the gold.
That's correct.
So.
Yes.
And I know you just did very well in the yearly Department of Public Health survey.
We did. We have yet again another deficiency-free
Which is
survey.
a huge accomplishment. So we want to say congratulations to you and the team
Thank you.
Linda Manor Extended Care Facility. And that's important for people to know.
It is.
You know, and I don't want to brag about, I do want to brag about Berkshire, but you should feel comfortable that your place you choose are winning awards and stuff, and hopefully we'll continue to. I want to go back, and you mentioned a little bit about the work you folks do with dementia care, and I know something you're really proud of, Emily, and you know I sincerely love your life enrichment program. So both of those things help folks with cognitive impairment. So we're going to start now with Emily, because you offer a great service to the community. Can you tell us about the life enrichment?
So our life enrichment program is also all-inclusive assisted living. And we have doubles there for people that need a shared unit, and we
Okay.
also have a studio.
Okay.
And our model at the Life Enrichment Program is habilitation directed. So what that really does, it capitalizes on people's strengths and their abilities versus what their losses or what they can't do because of the dementia disease process. And what I think is wonderful about our Life Enrichment Program is there's been a lot of thoughtfulness about the environment and about the training that the staff receive about behaviors and communication. And all of our activities are a main part of everything. We've talked about that at the campus. But what's really great about this is they do a lot of things that are very meaningful. So
Sure.
our residents are still volunteering. They're still participating in the community. They go over to a soup kitchen in Holyoke
Wow.
and participate in things like that. These are folks in the Life Enrichment Program,
that's
which is
fantastic.
just not something that you hear of.
No, and that will help them feel good about themselves
Absolutely.
doing things, and I think that's phenomenal.
Absolutely.
And I've been there and I've toured there, and I just love the feeling of the living environment.
Yes.
And I know you had a special designer design that area who her credentials are in dementia care,
Yes.
and just the colors and the paintings and the furnishings, you feel really comfortable there. So good for you. If folks want to check that out, they can give you a call over at
Absolutely.
the assisted living.
We'd love to
and
show
you'll
everybody.
tour away, right?
Absolutely.
So someone could start off there, and then if they declined and it was needed, they could go over to the extended care facility. And what do you have over there, Bonnie, to offer these folks?
Yeah, so I think the branch there is really if one becomes exit seeking. Our long-term care dementia unit is a locked unit. It's 41 beds. We offer activities from morning till night, whether it be on the unit or off. We have a program director, Sandy, who initiates activities such as watercolor, arts and crafts, mothering, nursing dolls, stuffed animals, things to really articulate the feeling of
Being needed.
being needed.
And taken
Thank you.
care of.
Yeah.
I mean, those are things that's human nature, especially in our gal residents. So it's
It
important
is.
to feel good about what you're doing. They need to achieve things. I love that you have volunteers from your LEP unit that go and help folks, and that your folks are doing things that they feel good about doing. So thank you for providing both of those services to the community. We're going to take a quick break.
Okay.
And get a load of this. During the break, you guys are going to see some more about what's going on at Linda Manor Extended Care Facility. And when we come back, we're going to welcome back Vanessa from the Alzheimer's Association, and we're going to talk with her about how we partner with them. So take a break, and we'll be back. See you in a few.
Nestled on 38 acres of pristine land, just minutes from beautiful Look Park and the offerings of downtown Northampton in western Massachusetts, Linda Manor Extended Care Facility offers you the best of both worlds. It's a locally run facility, staffed by dedicated healthcare professionals from the Pioneer Valley. And it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in Massachusetts. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Linda Manor is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Linda Manor, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice, and respite care services. We also provide services that fill specific needs of the community, like our Alzheimer's program dedicated to individualized care, maintaining dignity, and the highest quality of life for these residents. We proudly offer an elegant, home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Linda Manor is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings and more. Each resident and patient at Linda Manor receives the highest quality care, delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Linda Manor Extended Care Facility, we're perfecting the art of superior care. If you or a loved one need short-term rehab, extra care after a hospital stay, or a nursing supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-586-7700. We look forward to meeting you.
I'm chill. Welcome back to InfoSource, and as promised, Vanessa Martinez from the Alzheimer's Association is here, and you are the program director?
Program coordinator. Yes.
All right, I got a director here, a director, and a coordinator.
Okay.
All right, and I am none of the above, so welcome.
Thank you.
And the Alzheimer's Association, you're out of where?
We're out of the Springfield, well, I'm out of the Springfield, Mass office.
Okay.
But we cover all of Western Mass.
Western Mass, okay. So you'll go from Franklin County, Hampshire County, Hampden County, and the Berkshires, right?
Correct.
Okay. And you do all that?
Yeah, well, between me and the director, which is Marcia McKenzie. So
I heard she's a pretty good egg.
Yeah.
Should we shout out to her?
She is a pretty good
Okay.
egg.
All right.
So between her and I, we cover all the programs, educational programs. So basically, like, if you hear like the 10 warning signs, the healthy habits, the essential skills, and all those different types of programs, that's what we try to, we try to bring awareness and educate the community with these programs.
So you'll have those kind of educational opportunities at the association, but then you go out in the community and run
And try to
groups.
run programs and
Okay.
open groups along with like support groups and other, basically just to educate. And it's not only Alzheimer's. Sometimes people think that it's specific to just Alzheimer's, but we cover other dementias as well.
Yeah, and that clearly is another whole show, and I thank you personally and everyone out of your office for doing what they do. I've worked with those folks and the folks in Watertown, Mass. Just a tremendous amount of work that they do for a group of folks. Not only the folks from suffering from the disease directly, but also from their families, because you do a lot of caregiver support too.
Right. Actually, most of the people that we do service are the families, because they're the ones reaching out to us, looking for help, looking for the resources. One of the things that we offer at the Alzheimer's Association is care consultations, which is like a counseling for the whole family. Sometimes it's just the individual, the primary caretaker, but you will say, well, would you like to include the whole family or other support? Who's the other person supporting you in caretaking for this loved one, family member?
And you help them with that.
And we help them with that.
That's awesome. And how we've partnered, the Linda Manor Care Campus has partnered with you, is you've helped train. We have a support group we run, and you train that person who facilitates that. So that was good to have Jim go to their training. You've also partnered with us. We had a successful aging summit. And
This past October, you were
you were at
Linda Manor Care.
and you had an informational table, and I believe Marcia spoke.
Right.
Yes.
And that was really well attended. But we have
Very
also
well.
come, and I know a lot of folks in the community have come to help you guys with your walks, your yearly
Right,
walks. Can you take a
absolutely.
second, even though it just kind of happened?
yeah,
Say it again,
absolutely.
because people need to know about
Well,
this.
that's actually, we're not, the Alzheimer's Association is a nonprofit, so that's actually how we get most of our funds, is through our walks. So usually the walk takes place in September, and it's at Holyoke Community College, or at least in,
Pioneer Valley.
In the Pioneer Valley. And then there's also the Berkshire Walk, which I believe it's also in September. So that helps us to bring the care consultations, to bring out support groups to the community, to bring out these these educational programs. But not only that, but we also do research. So most of those funds actually does go to research. So we have what's called Trial Match, and that's open to the public. Anyone can sign up and just be the part of the research that we're, that's our mission, to have a world without Alzheimer's someday. So, anybody's open to that, and people think that they have to particularly have dementia, but no, we, all four of us can sign up for that trial match. And, there's different series of of research, so we can all, help
That's great.
to put in our, our little part in that.
Yeah, I mean, clearly what you do is so important, and I think the work that we do at the Linda Manor campus and the other Berkshire affiliates that have dementia care, because now it's different. I mean, in the past, pretty much every skilled nursing facility said they had dementia care, but not so true anymore, right, Bonnie?
Right.
You have to be...
You have to be certified, and you have to, there's certain requirements,
Yeah.
and, like anything else, certain guidelines to make sure that when someone says that their facility is dementia friendly, it really is. Because it's not just memory, there's other things involved with dementia.
Yeah, and
Absolutely.
at the extended care facility, you are that.
We are
And
that.
that's very good. And we have several other Berkshire affiliates that are that too, because it's very important to us.
Absolutely.
And also our partnering with you is very important, like doing the walks with you, having you at our educational in services for the community. And you have, I know, on your website, because you have a website, if people want to reach out to you.
If people want to reach out, we have an actual helpline number that the number that I'm going to give you, they can reach at any time, 24 hours, 7 days a week. So if they feel overwhelmed at 2 o'clock in the morning, we have there's someone there to answer your call, or even if you just want to talk and tell them how you're feeling, that you need help. That number is 1-800-272-3900, and that's available, like I said, 24 hours, 7 days a week.
Very good, very good.
And if they wanted to reach me, that would they can call that number too, or they can call my local number, which is 413-787-1300. But it's still the same. It gets rerouted the same way.
Okay. Well, I can't tell you how glad I am you came on, Vanessa.
Well, thank you for inviting me.
No,
Absolutely.
we are going to see much more of each other and work together to help folks with any form of dementia, Alzheimer's,
Right.
have a
Absolutely.
better quality of life. And clearly, you were just at the assisted living the other night, because I toured
Right,
you,
yes.
and I thought you were pretty happy with what you saw.
It was pretty nice. I can't say that I can complain. Absolutely not.
You don't seem like you're a complainer anyway.
You'd be surprised.
Oh, okay. Well, I know your daughter's in the house here someplace, so we won't
You
debate.
won't ask her, right?
I'm not going to ask her.
Well, before you asked me, I wanted to say that we do have, since we were talking about program and education,
Yeah.
before the year ends, we do have a legal and financial class that's going to be held at the Lee Library
Okay.
on December 9th from 10 to 12:30. So, and then I just wanted to bring that into the aspect that it's not always just caregiving and and just helping with dementia, but it's also like people don't think about the legal and the financial aspect of things, which is also very important. And it's all our classes and all our programs are free. What we do usually ask is for registration, just so we have an idea
Of who's coming.
And because we live in New England and it is in December, if we need to call you because of inclement weather or so on.
I really like the sound of that upcoming event, because it's true. You think of the emotional stuff,
Right.
and financial, and these other things are very
And
important.
sometimes
Logistics.
people,
Yeah.
right, and sometimes you're so overwhelmed with caring for someone that you forget about the legal and financial part of it.
That's something I think we'll think about and see if we can partner with you guys and do something out in
Absolutely.
Hampshire County with that.
So if they wanted to register for that, it's www.alz.org, which is pretty simple. So
I think you're pretty cool that you can rattle this stuff off like that. I can't. That's really cool. Anyway.
I think you're pretty cool.
Okay, it's the cool club here.
yeah.
Vanessa and Jenny Cool Club.
Yeah, there we go.
So thank you all three for coming on today. I'm super
Thanks,
excited to have
Jenny.
talked about the Linda Manor Care Campus. Any words before we go?
I
Any
don't
words?
think so.
Anybody can call you up at the Linda
Yes,
Manor
please
Assisted.
do. We'd love to have
Take
you
a
come on
tour.
over for lunch. We have excellent local farm ingredients. We'd love to have people come over.
Okay, so that's Emily. You want to say your phone number there?
Sure.
Or do you want her to say it?
Oh,
'Cause
maybe
she's
we
pretty
could. Okay. So it's 413-588-3300.
Okay, Bonnie. Any last words? I know you're shaking.
I'm
still
up for a
shaking?
tour too.
You're up for. You'd like people to come and tour.
I do. I like the one-on-one. I like
You like
getting
the
intimate.
one-on-one.
Yeah.
Okay.
I like to go through the property and really comb out what fine-tune
So
questions
vet out
they
what
have.
people's needs are
Yeah,
versus your
and you know,
services.
when you're there, I think questions that you don't think of actually pop up. So I always encourage someone to tour.
It's true.
Yeah, we don't need you to call ahead. You could just come on by. We have somebody there all the time to tour. But if you want to, my phone number is 413-586-7700, and that's the Linda Manor Care Extended Care Campus.
Okay. Any last words from you?
Yeah, I just want to repeat that we are at the Springfield, Mass office. Our address is 264 Cottage Street in Springfield. We're open from 8:30 to 4:30. And like I said before, the number is 1-800-272-3900, and you would get me if you'd call, you know, in the local area until about 4:30.
Okay.
After that, then you'd get someone else. But if you have any questions, certainly please give us a
But
call.
you're always open for questions.
Always
Okay.
available for questions. Well, not myself. If you call at 2 o'clock in the morning,
not getting you?
you're
You're
not going to
busy.
get me,
All right.
but you will
Okay.
get someone absolutely to help you.
All right, so
And
don't call Vanessa at 2 in the morning. She's not going to help you.
Right.
All right. Thank you.
I just want to repeat everything
Okay.
because I know sometimes people are like, oh, I want them
Yeah, go ahead.
to say that again. So then our website too, www.alz.org, if they want to sign up for any classes. And what you can do too is, because our next calendar of events will start in February, so you can look the classes up online and see what's going to be in the area.
All right, thank
Great.
you very much. Well, we've done it again. Another episode is over. InfoSource has been a presentation of Berkshire Healthcare Systems. Bye-bye.